Welcome to the ICT&health Podcast with Lucien Engelen and Jessica Workham.
Welcome in another edition of the podcast of ICT and Health. And my name is Lucien Engelen.
My name is Jessica Workham.
It's my co-host. And we have a very special guest today from AWS. Welcome, Myriam. Could you introduce yourself briefly?
Well, thank you so much for having me as part of this podcast. Yes, I am the head of health innovation for AWS for the EMEA region, so Europe, Middle East, and Africa. And what that means really is, as a clinician by background, I act a little bit as the bridge between business leaders and technologists to ensure that we are all driving in the same direction and making sure that we are helping transform healthcare.
Yeah. And today on this conference is a special day. It's the day where all the content for nursing is being concentrated as well. And you were trained as a nurse at first, right?
That is correct.
Yeah.
I am a clinician. I am a PhD nurse. Been in the intersection of healthcare and technology for over 20 years. So I still carry the nursing background in every single thing that I do. I always say that my role couldn't be done if I weren't a nurse.
Can you tell us a bit about your journey from being a nurse and now having a leading role in at AWS and how that impacts your role today and how that shapes it?
Yes. So when I'm Spanish, so I'm originally from Madrid. When I finished the university, I started to work in several hospitals in Spain, and I had the great opportunity to work with great leadership. But I quickly realized that there were many things that could be improved. And at that point in time, we are talking about an era where the digital transformation was mostly starting in healthcare.
Right.
EMRs were starting to get implemented or starting to be discussed. And I quickly realized that the technology had a big role to play in enabling a better healthcare for the day of tomorrow. And I decided that I wanted to be part of that journey. So quickly embarked on starting with a local Spanish company, implementing electronic medical records specifically for nursing, and then joined another company, Cerner, as the first Spanish associate in Spain, and gained responsibility over Europe, and then moved to the US. Spent there 9 years, and then came back in 2022 with AWS as the head of health innovation.
Perfect. And what are some of the top priorities for AWS in the field of healthcare?
Well, I think we are the world's largest cloud provider, most secure, most reliable. And we have been in a journey of democratizing the access to compute, storing in some of the other cloud services. And I think our journey is now even more focused on continuing that journey, but also democratizing the access on AI. So healthcare is facing unprecedented challenges, but I believe that we also have unprecedented opportunities.
Right.
So what are those challenges then, from your perspective? Let's say the biggest one that you would say that we face right now.
So I think if we looked at more developed countries, because if we go to some other underdeveloped countries, underserved populations, then the challenges are slightly different, right?
Sure.
But if we look at more of the developed countries, I think the challenges are pretty similar. We are all living longer, but with more chronic conditions.
Right.
And that's obviously increasing the cost of the structures that right now sustain the healthcare organizations. We have a terrible situation with our clinicians. I describe it like a parallel pandemic going on with clinician burnout. Nearly half of our clinicians are suffering burnout.
Right.
So that, in addition to the fact that we are having a huge shortage of clinicians, I think the World Health Organization estimated in 10 million shortage by 2030. I think all of that combined with the fact that we are also advancing a digitalization area that I describe it as a revolution, that also opens additional threats like security, like cyberattacks. I think the latest stats that I read was that there's an 60% year-over-year increase in cyberattacks to healthcare organizations.
Wow.
So I think we have like pretty a good breadth of challenges to work through.
There's no shortage of challenges. No.
Right.
Correct.
But there is no shortage of talent either.
Yeah,
And that's the beauty of it, right? I mean, everyone is really identifying these challenges and thinking through potential solutions. And the talent that sits behind some of the innovations that are happening is absolutely amazing.
Yeah, I think the cyber attacks are something that we are unfortunately noticing because sometimes we do have outages in our hospital, and it does get fixed really quickly. But I'm curious how AWS tries to combat that with their cloud service.
Yeah, so as I mentioned before, we are the largest cloud infrastructure technology provider and the most secure and reliable one. We have a very unique way to build an infrastructure. We build what we call high availability zones that are composed by one or more data centers. And wherever we have 3 availability zones together, we form a region.
Oh, I see.
So this means that we have 120 availability zones across the globe, formed in 38 geographical regions, several of those in Europe. In addition to that, we have just launched in 2025 the European Sovereign Cloud, which goes beyond the existing AWS regions that we have in Europe, that it is fully operated by European citizens and European residents.
That's amazing, because that's for us very important that we have an option like that.
Yeah, I mean, obviously the safety and security is the same as the rest of the regions.
Sure.
It's just that additional layer. That makes sense that it is really focused towards public sector customers and highly regulated industries.
Yes.
So
Like healthcare.
So really depending on the workload, I would say, really you would go to the European Sovereign Cloud or any of the other regions across Europe that we have as well. I think this is important to note that this is twice the availability zones and 3 times as many data centers as the next largest cloud provider.
Wow.
Which means that translates into having less than half of the outages and less than 1/3 of the downtimes.
Wow, that's amazing.
So it is not the security not only around the additional services that can add additional layers of security, but also about how quickly you can recover.
Right.
Unfortunately, when you have one of these events, right? Because
Which will occur.
Exactly.
It's a certainty.
It's just how do we add additional layers, and then what's the capability to recover quickly?
Yeah. So I would love to learn about where AWS is now, as you just mentioned, and where is AWS in, let's say, in 5 years from now, and what will clinicians like Jessica and others feel of that? What will they see? And apart from even less outages and less breaches and stuff like that, what is your perspective on that? What's the aim? What's the goal?
I think, as I mentioned at the beginning, we have been on a journey on democratizing access to some of the traditional compute services, storage services. We are enabling the ecosystem to innovate faster. And that goes all the way from working with 19 out of the 20 life science companies. They work with AWS. The top 10.
I won't ask the question who's not.
The top 10 medical devices companies, so all the way from, we have great collaborations and partnerships with Philips, GE Healthcare. They are developing their innovations in partnership with AWS using our infrastructure. But also 80% of the healthcare and life science unicorns. So enabling, as I was mentioning before, the great talent that exists out there that is coming up with amazing ideas that really are looking to solve problems and enabling the ecosystem to innovate. I think while I don't make predictions about the future, I think, that's...
We have AI for that.
Right.
Running on their platform.
But I think the word now is exactly AI, right? And how are we going to start feeling and looking at some of the agents that can automatically take some of the most administrative tasks that are certainly producing a burden in our clinicians and automatizing those so that our clinicians can really focus on the things that they were trained for. So we can use our clinicians at the top of their license, and not wasting time on inefficient activities that is really, one, not making them happy, and certainly not bringing value to patient care.
No, absolutely not. So we would love to wrap up always all the podcast editions with one advice that you would give to all the healthcare workers outside in terms of on the frontier of innovation, in terms of what's happening, what should you do, what would be your advice with all the knowledge, the expertise, and also your past careers in that?
I don't know that I have an advice per se.
Or call to action.
Suggestions, some ideas. I think we need to come back to basics in terms of any time that we are approaching a new innovation, whether I am a physician, a nurse, or working as a company, working inside a hospital. Let's make ourselves the question on what's the problem that we are trying to solve.
Yes.
And how are we going to measure success in a manner that can relate back to patient outcomes? And I think if we approach it in that manner, then working backwards from there, thinking on, okay, what is the right innovation for this? Use technology as an enabler, but technology is never the end itself, right? And certainly cannot be alone. So when it comes to artificial intelligence, and we are seeing a lot of hype and discussion around this right now, and agentic AI, it is true that the opportunity is incredible, and we are seeing other industries like life science already using agentic AI. So I don't think it will be long till we see it coming full speed into the healthcare arena. But I think if we think it in a manner on how can we use AI and agentic AI to augment human wisdom, then is when we will make sure that every personal story that is sitting behind a patient will matter. So that's really my advice, is let's come back to the basics. If the advice or the suggestion is for clinicians, like, why did we study what we studied was to really take care of people.
Right.
So let's make sure that that's front and center in any innovation that we do.
Start with the patient, start with the problem.
Not a better note to end this podcast on. Thank you very much.
Thank you so much.
Thank you.